They're the unsung heroes of the medical field, and they play an integral role in your healthcare. Yet you have probably never met any of them or even know what they do or how important it is. Pathologists and other lab testing professionals are critical to the accurate diagnosis and consequently the treatment of medical illnesses. About 3/4 of the information in a person's medical record is diagnostic results, and 70% of all medical decisions are made based on results of laboratory testing.
The pathology laboratory plays a critical role in women's health care in almost every aspect or stage of a woman's life. From detecting sexually transmitted diseases in young women to prevent infertility later on, during pregnancy to promote healthy babies, and later in life to help manage symptoms of menopause or detect cancer early to promote a cure.
The laboratory's role in the treatment of my patients is absolutely crucial. You know, they say it takes a village to raise a child. Well, it takes a village to take care of a patient. I depend on the laboratory results to direct my patient care and to try and get the best outcomes.
For women, the role of the pathologist is especially significant. Pathologists are medical doctors like the ones we all know from clinics or hospitals who have chosen to work behind the scenes and become experts in the field of disease detection. Known to colleagues in the medical profession as the doctor's doctor, the doctor scientists work diligently in the laboratory, examining samples to reassure the healthy and diagnose the sick, uncovering the cause of symptoms so patients can receive effective treatment.
Accurate pathology information is very crucial in women's health. Recently, compared to 20 years ago, we are doing less and less of visits and less of testing. So if we had inaccurate information, you can see how that can really delay the evaluation and treatment.
Everyone in the laboratory understands how much physicians and patients rely on the accuracy and timeliness of the results we deliver. It's critical that they understand the instruments and methods that they're using, be experienced and well-trained so that they can confirm that the tests are being run properly and that the results are accurate.
Dr. Julia Elvin is a pathologist who pursued additional specialized training in women's pathology and now practices in the Boston area. She says working with patients' samples is almost like working with the patients themselves, and that her work contributes so meaningfully to their care.
As a member of the clinical care team, I always remember that a woman is attached to every blood sample or tissue slide. In fact, I think of my microscope stage as a mini examination table, and I'm just getting a closer look at a particular part of this patient. Sometimes I end up with questions which I need to consult with the physician who sent in the sample, and we compare notes so that we can get the best, most complete picture and get to the right diagnosis.
The pathologist's role in patient care continues even after a diagnosis. Ongoing testing is used to detect the effectiveness of treatments and to determine if a patient has been cured. Since most patients are unaware of what's going on with their blood, cytology, or tissue specimens, few have ever considered looking into the quality and value they are getting from the lab doing their testing. Most rely on their primary care provider or specialist to make a good choice.
In my opinion, having that personal relationship is the most important fact.
Recently, as medical consumers are being asked to bear more financial responsibility for their care, patients are becoming increasingly educated about the price and value they are getting from different hospitals or imaging options like CT scans or MRIs. What patients may not know is that they have a choice in laboratories, or at the very least, can influence their doctor's choice based on what is important to them. For instance, cost of testing or accuracy track record.
What most patients don't realize is that they have a choice in which laboratory does their routine clinical testing. And often, by exercising this choice, they can get a lower out-of-pocket cost. Patients usually have fewer options when it comes to tissue taken out at a doctor's office, at least for the initial interpretation. However, if you've got one place where you can have a second opinion, the most important is on the pathology, because every subsequent medical decision made by all of the other members of your clinical team stems from what's written on that pathology report, and that needs to be absolutely correct and accurate.
Effective medical treatment starts with an accurate diagnosis. For patients, choosing a laboratory should be as important as choosing a doctor. Converge Diagnostic Services is a full-service clinical cytology and anatomic laboratory located in Peabody, Massachusetts. Converge delivers state-of-the-art diagnostic testing and support services to the prestigious New England medical community. Converge delivers the highest quality diagnostic services at a reasonable cost. These are tough economic times, and Converge understands that and has purposely priced their services to be the most affordable laboratory in the New England region. The highly trained laboratory professionals work closely with physicians, other healthcare providers, and hospitals to ensure patients get accurate and timely diagnoses.
Converge Diagnostic Services' mission is to be recognized in New England by the employees who work at the company, the clients we serve, and their patient for outstanding service. Very simply, at Converge, we believe that we should measure ourselves based on what others think of us, not what we think of ourselves. And that's how we measure ourselves every day.
Converge Diagnostic Services delivers a full array of state-of-the-art laboratory testing, specializing in women's health. Converge also serves primary care and internal medicine clinicians, college and university health centers, and works as a specialty service reference partner to regional hospitals.
What distinguishes Converge in the New England marketplace is first and foremost the dedicated lab professionals we have at the company. They do an outstanding job every day servicing our clients. Number two, we're a full-service laboratory. We service primary care and internal medicine. We have a tremendous women's health program. We service colleges and universities, and we partner with hospitals and local pathologists serving local communities. Third, we're a local company. By local, that means we provide 100% of our services out of Peabody, Massachusetts. And finally, price. We're the most reasonably priced laboratory in the New England market. In a time of high deductibles and copays, we find it imperative for their clients and the patients they service to offer them the most attractive pricing. When you come to Converge, it costs you less.
I recommend Converge Diagnostic Services because I find that their clinical staff is just outstanding. I feel like they're a vital part of my team, and they actually almost feel as if they're there with me, with the patient in the office, even though they're in a separate building.
Accurate, high-quality lab testing is critical to patient care, but it doesn't have to be expensive. Converge Diagnostic Services, at your service. Visit us online at convergedx.com.